The human spine is the central axis upon which our whole body is arranged. It is to this axial skeleton that the appendicular skeleton with the arms and the feet is attached. Through this spinal column runs the spinal cord that is at the top attached to the brain, thus governing the function of all systems in our body. The spinal column, consisting of these vertebrae, the intervertebral joints and the paraspinal musculature, is very essential for all functioning of the body. Yoga gives tremendous importance to the human spine, calling it the brahmadanda, meaning God's own walking stick, as if our spine is the walking stick of the divine. Keeping it healthy is very important in the yogic view. The various asanas that help stretch the spine, where you stretch up in the thalasana, or you turn in the Trikonasana, you bend forward in the pawan mukta. All the asanas are based upon either the flexion, that is the bending forward, the extension, the bending back, or the twisting of the spine. Through the regular practice of yoga from childhood, we can prevent the numerous problems such as back pain, lumbago, the sciatica, the neck pain that is affecting so many people today. With the increased automation and use of computers, more and more people are coming down with low back, mid back and neck pain. Yoga strengthens the entire back, strengthens the spinal column through the right useness of the spinal column. This presentation takes a look at asanas that help us to stretch the spine. The entire spinal column is given a healthy tug, giving self-traction to your spine, helping pull the vertebrae apart, giving that traction that normally would only be given in hospitals, where you put a weight on one side of the head and on one side of the feet. The asanas provide that isometric stretch that is so essential to the muscles of the back, stretching the muscles yet giving them relaxation. Practices like the pawan mukta help relieve back pain and neck pain in a very effective manner. A gem of a practice is the Brahma Mudra, where we turn to the right, to the left, up and down. This turning is done along with the breath and along with the sound, nada, providing healthy vibration to the tissues of the neck. We must never forget that the neck and the back are one and the same. A person who has a neck problem today will have a back problem tomorrow. Person who has a back problem today will have a neck problem tomorrow. It is essential that yoga therapy deals with the back and the neck as one unit, strengthening the back muscles, strengthening the joints, giving us increased turn ability, the ability to turn that is so lacking as we grow older. This presentation takes a look at the excellent musculoskeletal relaxing practices such as the Kaya Kriya, where the feet, the arms and the head are relaxed in a step-by-step manner. The Drida Kriya, which is an excellent relaxer for the spine, is also introduced. Practices such as the asanas to strengthen and relax the paraspinal muscles, the practices to help improve the flexibility of the spine, the pranayamas to reduce stress that creates a tension in the muscles. All of these are introduced in this presentation. The restoration of balance of the three doshas, Vata, Pitta and Kapha. Vata is the one which is the air. This air element, which in Ayurvedic and yogic terminology is called Vata, it affects the joints. So the joints of the neck, the joints of the entire spinal column, these are brought into their normalcy by the practice of pranayamas such as the Shitali and the Kavi pranayama. Of course, it may not be possible to do all the practices in this presentation at one time. I recommend that you consult a qualified yoga therapist. Make up a schedule according to your age, gender and physical condition, and follow that schedule in a regular manner. With the regular and dedicated practice of such a schedule, I am sure that you will soon move from that state of ill health to that wonderful state, the state of optimum health. Namaskar.